The following portion of Good Day PA is sponsored by Cardiovascular Experts. Do you or someone you know suffer with varicose veins? Those blue and purple veins on your legs possibly can produce aches and pains, and unfortunately, they might lead to potential health complications. Sonny Diamond returned to Cardiovascular Experts to talk with Dr. Raj Dave about venous insufficiency.
Hi, and welcome back to Dr. Raj Dave right here in Camp Hill at Cardiovascular Experts. It is a wonderful place to be for people who have issues with their veins, and in the summer we see a lot of varicose veins when you're wearing shorts or in ladies' situations, higher dresses, and we think about all the things we need to do and try to cover them up. That might be one thing, but do you know what venous insufficiency is? It's a lot more serious. Let's talk about that today.
So venous insufficiency is a disease of veins. It's a painful condition. Veins are just blood vessels which take blood from legs towards your heart. It has one-way valves. As we get older, and sometimes there is a disease development in these veins which leads to destruction of these valves, that leads to blood pulling into the legs, which increases the pressure of the blood inside your legs, and that leads to signs and symptoms of what we call venous disease or venous insufficiency.
Well, it is a disease, and it really does have symptoms, true symptoms that you'll explain.
So symptoms, the most common one are edema, pain. Some people describe it as Charlie horses. Some people call it night cramps. Some people have cramps during the day. Itching of the skin, discoloration of the skin is very common around the ankle. And then in advanced stages, you're going to see large bulging veins, which are called varicosities, and then you develop a venous ulcer, which is an ulcer that usually occurs on the inner part of the leg. And then it stays there and it doesn't heal quickly. And those are frequent signs and symptoms of venous disease.
It sounds very painful.
It can be.
Yeah, it could be, and who is diagnosed with it is important.
Yeah, so the most common risk factors, of course, the aging population. As you know, our population is aging, and age over 50, as we get older, the valves wear out in the veins, and that leads to venous insufficiency. Women are at particular risk, especially due to pregnancy. Sometimes obesity and smoking add fuel to the fire, and it also increases the risk. The other important thing, it runs in the families. So if your parents have it, your siblings have it, you're likely to develop it, and you should be on the lookout for it.
Yeah,
so those are important things.
Absolutely. It could be something that you've seen in your family before. I understand this. If someone has symptoms, what should they do?
They can call our office. They can, I think it's not good to suffer in silence. Ask your doctor about it. Sometimes they can just look at your legs and can diagnose you with venous insufficiency. Or we can do an ultrasound, which is a very quick, painless test, lasts 20-30 minutes at the most, with an ultrasound and some little gel. And we are able to tell you whether you have venous insufficiency or not.
And that's important to get that part done. How do we get in touch with you?
They can certainly call our office. The number is on the screen, or they can visit our website and they can contact us that way. We also run frequent screenings, which usually does not require any kind of referrals. And it's very, very easy to do that.
No one should be afraid to come in.
Absolutely not.
And you might have symptoms, you need to know, and this is where you get your answers. If you wonder how patients can contact Cardiovascular Experts, it's easy. Call 717-727-0480 or visit cardiovascularexperts.com. If you feel you might need a consultation, do call or visit that website, and you will meet personally with Dr. Raj Dave. Thanks again for always coming and delivering great, interesting educational news.
Thank you very much.
The previous portion of Good Day PA was sponsored by Cardiovascular Experts.